it's Jenny and Friends. Steve Marshall, joined by Dr. Kohli, 9 News medical expert. Also, you have Cherry Creek Hart in Aurora, does her own practice. She's an associate professor at Johns Hopkins University and Duke University, all the places. And you went to Harvard. Oh my goodness, preventative cardiologist too. I'm going to need you for sure. We've been working on that because it's a hereditary thing in my family for sure. So when you and I talked, we decided, hey, we should start doing these little health tidbits to help people. And one of the things we wanted to discuss today was like the stress of being a new parent, especially around the holidays.
Oh, it's so stressful and incredibly stressful. And I don't think we recognize it enough, because we just sort of think of it as a motherhood is natural, fatherhood is natural. But the stress of having a new baby and coping with not just the physical changes, but the emotional changes that come with it. So if you think about new moms, like new dads as well, sleep schedule completely disrupted, financial stress of having a new child, time away from work and all of that. And then for women, the hormones right after you deliver, as you may recall, they can really sort of impose an additional stress. So I think it's important to have a discussion about this.
Well, and also like the not knowing, like I feel like the stress of just like you feel like you absolutely have no idea what's going on. You're like, okay, my whole life is right. You just go through it.
And it's imposter syndrome a little bit because you always feel like you're failing as a parent. You always worry about failing. And then now in the era of social media, it's really amplified this sort of, well, other people are doing this, or what should I be doing? Or, this comparison culture where we're looking at what others are doing and worrying that we're not doing it right. And there's no rule book when it comes to raising a child. They don't come with instructions. Although I did, when my brother had his baby, bought a little instruction manual.
Oh, yeah.
It was really cute.
Like, hopefully it helps a little bit, right?
And he actually looked up stuff in it.
Nice.
It was cute. It talked about diapers and feedings. And I heard there was this really cool app that tells you when your baby is crying, whether it's a hungry cry or a wet cry or a...
Oh, wow.
So I feel like
it's
AI...
like a baby translation app?
Yes, AI may
They
start
didn't have
helping
those
us.
when they did not have those. It was like, don't Google it, Jenny. Don't Google it. Oh my gosh! It was like basically when you're sleep deprived in the middle of the night. Like,
And
what?
if you already suffer from anxiety, if you have anxiety issues and things like that, I mean, that can be compounded multiple times with children.
Very much so. And this is, again, something that's not quite recognized. And we don't really know how to tease apart. Is it just what we call baby blues, whether it's anxiety or depression, or is it actually something like postpartum anxiety, postpartum depression, or a condition called postpartum psychosis, where it can actually, all this hormones and the pregnancy and the stress can trigger a psychotic episode in some women. So I would say looking at the timing is really important. When the baby's just born, about 2 weeks after, you can have the baby blues, you can have that anxiety. That's all really normal. But when the hormone kind of settles down in a couple of weeks, you really should start to bond with the baby. You should be sleeping when the baby's sleeping. And if you're not, that's a bad sign. That means something might be cooking. If you're not eating properly, if you're having feelings of intense guilt, intense worry to the point where it's affecting your functioning, these are all clues that it could be turning into something that's a real psychiatric disorder.
That's scary.
Yeah.
And it like you said, you don't really know. So you kind of have to be able to be your own advocate and say, hey, okay, this isn't normal for me. I don't feel normal. And you got to be able, I think, to have like that honest conversation with your doctor about it, because I think you go in, you're like, no, I got this. No, don't get this. Not now. Not right now.
And that's where I think the family members are really important too, because sometimes you don't even know that you're doing something unusual. So for example, postpartum psychosis, sometimes you don't have, it's called insight. You don't know that you're acting a little unusual or a little erratic, or bipolar disorder is another one where you can get mania triggered after a pregnancy. So that's where your spouse, your family members, your network gets really important. So whether you are a parent yourself or you know somebody who's a parent, it's really important when they're a new parent for you to really constantly sort of assess not just how they're doing from a physical standpoint, but also how they're behaving and kind of if their personality has changed or their characteristics have changed, or there are any red flags, then you point it out to their doctor.
Now, I mean, with social media, which you mentioned earlier, a lot of these celebrity moms make it a big deal about how fast they lose the baby weight and all of that. Is there any rule, or, I mean, is there a healthy way to do it?
There is, and I get worried now because I see a lot of new moms coming into me wanting weight loss drugs and what have you. And so what the kind of general rule of thumb is that the first couple of weeks you lose 10 to 15 pounds. That's right after the delivery. And then 2 weeks to sort of 6 weeks, you're losing about a pound a week. If you're losing more than that, especially if you're nursing, it can actually be bad for you and bad for the baby. And then afterwards, of course, you want to shift into preventive mode and try to keep off that weight, get back to the pre-pregnancy weight. But again, with that a pound a week sort of being your rule of thumb.
And give yourself grace. For sure.
Yes.
totally.
Yes.
And your body will not look the same and should not look exactly the same after pregnancy as before. And
What about like 8 or 9 years later?
Well, you make jokes about it, but I say aging is a privilege that not all of us have. Especially women are pressured to always look the same.
Yes.
And that's not how we want to do. We want to flip the chapter and look at the next chapter of our life, and we look different in every chapter.
Well, it's Dr. Kohli. You'll see her on 9 News. She's their medical expert. Also, Cherry Creek Heart. It's in Aurora, and she is accepting new patients. So make an appointment and, talk to her about your heart, about all of these things that can really, being preventative, can really help make your life more enriched.